Hi, my name is Paul Gill, and I work in health promotion in the HSE based in Murdoch Park in Galway. And we are here to introduce you to a number of physical activities that you can do from your chair, and particularly to support staff who are participating in the Move More at Work programme. That particular programme aims to reduce sedentary behaviour amongst staff here in Community Healthcare West. And they focus on 4 themes really. One is to lift it, shift it, move it and improve it. Now, it's not only for those. We invite all staff in the HSE and even our partners who would like to avail of these particular sessions to please do, with a view to obviously integrating more physical activity into your daily life. So what we've done is we have developed 3 particular sessions. Session A and Session B are of short duration. They're about 12 minutes each. And in each of those sessions we try to focus on the major muscle groups of the body, but we've introduced a variety of different activities in each of the sessions. And then Session C is the longer session, which is an amalgamation of the 2 of A and B, which perhaps if you had time at work, it's about 25 minutes long, please do it, or you can avail of that by doing it at home. So what we do is that I will show you an example of the activities, again from the chair, but it's up to you then to maybe focus on the number of repetitions that you would like to focus on, and that depends on how you feel that day, it depends on your fitness level, it depends on a number of things, but it's up to you. The general guidelines really in terms of activity is to try to incorporate 30 minutes of activity into our daily life, 5 days a week. But you know what? You don't have to be hard on yourself, particularly when you're starting off. Just go from nothing to something, and over time, incrementally, you'll be able to build it up as your fitness improves. But we would say as part of that, just to self-monitor, mind yourself, depending on your back, depending on your knees, depending on your neck, any issues, pay attention to those. And if you feel that any of the exercise would cause pain or anything in those particular areas, just stop. The last thing I would say is please to make sure that you have a solid chair, no casters, to make sure that it's sturdy, because that makes it so much easier going forward. So we hope you enjoy them, and we'll go. Okay, so just to start off, the one thing I would say is just to make sure that your base is fairly strong. So make sure your feet are kind of flat on the floor and that your backside is against the seat of the chair, just to give you a strong base of support. So what we'll do first of all is to focus on our shoulders and our neck. So just place your hands down by your side, just let them rest there, just shrug them. Just bring them up to your ears and let them drop. It's just like somebody asking you a question you don't know the answer. I don't know. And now just gently bring your head over to your right shoulder if you can, and over to your left shoulder, and come back to your right shoulder, and left, and right, and last one to the left, and just center it. Now just gently we're going to imagine our head is just like a pendulum, just on a clock, just like a clock. So we're going to drop the head slightly, and we're just going to roll the shoulder, or roll the head to the left, and to the right, to the left and right. The whole idea is just to release any tension that's there in the cervical spine, the cervical part of the spine, just to roll the head left and right, and come back to the center. And now just again, sticking with the releasing of the tension in the shoulders, we're just going to relax the shoulders a bit, just bring them up to the ears and drop them back. So roll the shoulders up and back, and up and back, and last one up and back. And again you should feel a bit of tension there being relieved from the shoulders. Okay, and now we'll stick with the shoulders, but this time we're going to roll the shoulders forward. So we'll keep the hands down by our side again. We're just going to bring the shoulders up and just rotate them forward, forward position. So up, rotate forward, and again that just loosens out all that upper body there. Then related to that, we're just going to imagine that you're in the pool. So just do a swimming stroke. Just come forward, bring the hands up and forward. I know somebody will criticize my swimming stroke, but just try to simulate what you think is a good swimming stroke. Just go like that. Nice and gently, and come forward and relax. Okay, this time we're just going to focus on our biceps here, which is the muscle here in the upper arm. So just keep your hands down by your side, make a fist with your 2 hands. Bring the 2 fists up to your shoulders and back. Bring them up to your shoulders and just squeeze at the top there. Just squeeze there and back down. And just squeeze there and back down. And now we'll just integrate a leg movement. Just push out the right leg and back. And left leg and back. And right. And left, and just squeezing the arms at the same time. Right and left. Okay, so just going to focus on our back now, and I would be saying this too, it's important to be mindful, particularly if you have a bit of low back pain, but at the same time it's important to try and strengthen your back. And a good way of actually trying to eliminate back pain when you're doing this exercise is keep your chin parallel to the floor. So place your 2 hands on your knees, just come forward, but your head is up, chin parallel to the floor, and push off the knees. Come down, chin parallel to the floor, push off the knees. Come down and push up. Come down and push up. The next one, I just want you to imagine that you are doing a solo. You're in Wembley Stadium, people are screaming out your name, you're doing your solo piece on the piano, but I want you to imagine now it's a circular keyboard. So you're just moving to the right and left, and right and left, and gently try to make the high notes. So you're turning right and left. Just increases a bit of mobility there in the lower back, up and down, and up and down. And back to the centre. And just another additional piece for the back. Just make sure your back is supported again against the back of the chair. Just hands down by your side and just gently bend down to the right, centre and left. Centre, right, centre and left. So you're reaching for something in your handbag, and down, centre and back up. Right, centre and back. Okay, this time we're just going to focus on a little bit of cardiovascular activity, believe it or not, from the chair. When we say cardiovascular, you're introducing kind of the heart and lungs. So there are 3 things that will happen. Your breathing will increase, your body temperature will increase, and your heart rate will increase. So that's all normal. There are the 3 kind of body clocks that happen once we do a bit of cardiovascular activity. And we all know that cardiovascular activity is hugely important for our physical health as well as mental health. So just to show you, I just want you to imagine that you're walking in your chair. So just imagine, so I just want you to lift the legs up, swing the hands just beside you, and if someone is passing your door, ignore them. Just keep going, just lift the legs and lift the cheeks of the bum off the chair. Just lift the legs, cheeks of the bum off the chair, and now just make an effort to come out to the edge of the chair, and we'll use a hip hitch to go back. Back out, and back. And this is the importance of having a chair without any legs, because you don't want the seat rolling underneath you. So you just come out to the edge and back. So you just keep walking. And just another variation is just to walk around your chair. Just walking to the right and the left and the centre again, and left and the centre. And now we're just going to introduce another variation. Right leg out, left leg out. Right, left, right, left, right, left, right, left, right, left, right, and left. And then just gently touching the knee. Right leg, left, right, leg. And then the more proficient you get, you might be able to just bring the leg up sufficiently to clap underneath them. And relax. Okay, we're now going to move to the legs. Quadricep muscles here are some of the biggest muscles in the body. So it's very important obviously to keep these strong, because these provide support for our upper body and for our frame essentially. So we're just going to focus on maybe strengthening the thigh muscles for this particular exercise. So sit back in your chair, just to raise your right leg and just squeeze the thigh and come back down. Left leg up, squeeze the thigh and back down. Right leg up, squeeze the thigh and back down. Left, squeeze and back. Right, and squeeze and back. Just hold it for a second or two and back down. This time we're going to hold it, back down. We're going to throw the hands up. Left leg, squeeze, back down, overhead press. Hold it, squeeze, hands up. Left leg, squeeze, hands up. Right leg, squeeze, hands up. Left leg, squeeze, hands up. So and again, just to move on again, but we're still going to focus on our thigh muscles. So this time we're just going to raise our right leg up, squeeze and back down. Left leg up and squeeze and back down. Right leg, squeeze and back down. Left and squeeze and back down. Right leg, squeeze, and this time we'll throw in the arms onto the side laterally. Left leg, squeeze, back down, take the arms up and back down. Right leg, squeeze, take the hands up and back down. Left leg, squeeze, take the arms up and back down. Last one, squeeze, arms up and back down, and left, squeeze, and arms onto the side. So now again we're just going to go back and do an activity for our triceps here. They're a little bit more difficult, but two variations. One is an easy exercise, and then one is we just adapted to make it a little bit more difficult for us. So they're called tricep dips. So just place the heels of your hand, like before, on the edge of our chair. Just walk out with the 2 feet, keep your legs bent, and then just gently lower your bum to the floor. Bend the arms and straighten. Bend the arms and straighten. Bend and straighten. And just come back and sit down. And just to make them a little bit more difficult, where you're carrying a bit more weight on your triceps, just extend the hands, rest on your heels. And you just lower the body, bend the arms and come up. Bend the arms and come up. Bend the arms and come up. And then just gently, for safety, walk back in gradually. Place your bum on the seat and you're home. Okay, so now we're just going to focus, believe it or not, on our calves. Small little muscles down here in the lower part of the leg, but crucially important, and particularly, strengthening the calves is important because there's a little pump down here called the soleus, which is hugely important for venous blood flow and returning venous blood back to the heart. So all we're going to do simply, again maintaining our strong base, just come up onto the toes and tighten your calves as you do that. Just come up onto the toes, tighten your calves and back down. Come up onto the toes, tighten your calves and back down. We'll just add in a little variation. Come up onto the toes, push out and pull and down. Come up onto the toes, push out and pull and back down. Come up onto the toes, push out and pull and back down. Okay, and we're back now to focus on the main muscles here on the upper leg, the quadriceps, 4 muscles here. It's important again to keep these strong, and a very simple exercise we can do at work is very simply just to go from sitting position to standing, pressing through the floor. So just press through the floor, come up and stand up and just squeeze the buttocks at the top of that. These muscles here are hugely important for supporting the lower back and the upper body. And then just sit down slowly. And again just pushing through the floor, come up, squeeze the buttocks and back down, sitting down slowly. Come up, push through the floor, squeeze the buttocks at the top, and then just slowly sitting down. We're just going to add a variation to that, a slight variation, pushing through the floor, squeeze the buttocks, come up onto the toes, lower the heels, and sit down slowly. Push through the floor, squeeze the buttocks, come up onto the toes, lower the heels, and sit down slowly. Last time, we're just pushing through the floor, come up, squeeze the buttocks, come up onto the toes, lower the heels, sit down slowly, and relax. And again, because the legs are so important, we're just going to focus on the legs again, but this time we're going to do assisted squats, but we're going to go to the back of the chair. So we just push through the floor again, stand up, and just walk around to the back of your chair, rest your hands there on the chair like that. Keep your body upright if you can, ears over shoulders, over hips, over knees. And just stand upright and just gradually, slowly bring down, go low and slow and push up. Come back up and low and slow and push up. And then down slowly, low and slow and push up. Just do as many as you feel comfortable doing, just to build up the muscles there, but keep yourself supported here. Hugely important as well, particularly as we age, flexibility in the hips. So I'm just going to show you a very simple exercise to mobilize the hips quite easily. So just again, remain assisted here, place your hands on the chair, keep your foot at 90 degrees to your leg, just push that leg out to the right, do 3, do another one. Onto the left. Again, keep the foot 90 degrees to the leg. Push out. 1, 2. Push out. And gradually the range of motion will increase over time. Even if it's small at the start, don't worry, that will increase over time just to mobilize the flexion there, the hip flexion and mobility there. Another one we're going to show you now is a lunge, an assisted lunge. So again, we'll just place the chair here beside you. Keep your left arm on the chair. And I want you to just imagine if you're going to genuflect. Bend down. We'll just do the right leg all the time. Bend down. Try to get a 90-degree angle here so that the thigh is parallel to the floor. And come back up. And come back up. And relax. Now we'll focus on the left leg. Come back up. Remaining supported here all the time just makes it very, very easy. But you're building the strength in the leg, almost like a single squat. And come back up. And relax. Okay, sometimes the muscle group that's overlooked are hamstring muscles, the muscles here at the back of our leg. Hugely important as well to keep those flexible and strong, because there's a direct connection between here and the lower back. Now, we did a lot of work on our quadriceps and our calves, so just the hamstrings are important. So just turn to the back of your chair again, just lean on that for support, bend your right leg just like so, and just bring your heel up to your bum if you can. Extending the leg down, extend down, bring the heel up and down, very simply. That's all. And then we just alternate the legs. The left leg down. So that's our supporting leg. So bring the heel of the left leg up to our bum, back down, and back up, back down, and back up, and relax. Very simple. Okay, I'm just going to show you 1 or 2 exercises again now that you can do from a seated position in your chair, which focus mainly on definition. But what's critical here is that you breathe out all the time when you're doing these, because sometimes it can lead to a bit of pressure on your heart if you don't breathe out. They're called isometric exercises, which means they're static. There's no movement, shortening and lengthening of the muscle. It's just static, but it does increase a little bit of pressure on the heart. But to alleviate that pressure, just breathe out. So very simply, just place your 2 hands together in front of your body, place them together like so, and just squeeze. But continue to breathe out, that's why I'm going to talk now for most of these. And you'll feel the definition right across your chest and your arms. Just squeezing there, but by talking it ensures that you're breathing. So nice and gently, just press against each other and relax. And then you can vary the angle by pressing down. You're just targeting a different part of the muscles in the upper body. But again, the critical thing is to breathe out, breathe out, breathe out. So if you're good at singing, sing, breathe out, and you can feel the definition there in your hands. And relax. And similarly, we go up, just kind of up in front of your forehead, just pressing again, the 2 hands pressing against each other. You're just targeting a different aspect of the muscle, but it increases definition there. And relax. Come back. Very good. So the next one that we're going to do is we're going to interlock the fingers this way. Something similar. So interlock the fingers and then pull. So again, static contraction, but please breathe out. You feel the definition all along here in the shoulders, building up here. So interlock the fingers and just pull. Just pull. Yeah, breathe out. Don't be afraid to breathe out. You'll feel it. You can feel that in your chest muscles as well, all across your upper body, right across the back of the arms. Very, very good. But again, critically, breathe out, breathe out, breathe out, and relax. And the last one I'm just going to show you is very simply just putting your left fist over your right, and similarly pushing down with the left, up with the right. And again, but just breathe. Nice and gently, and again, these are more or less for the shoulders. Just to breathe out, breathe out, breathe out, and just alternate, right on top, left to the bottom, down with the right, up with the left, and breathe. You'll feel your body temperature increasing as you do this, but by talking, you'll certainly ensure that you're breathing, and that's critical. And relax, and come back. Well done. Okay, so just to finish up our session here, whatever, it's vitally important as well, I suppose, and it shouldn't be overlooked. I'm just going to show you a few stretches that you can do for some of the major muscles, but again from the sitting position in our chair. And again, often if we sit too much at work or whatever, what happens to the ligaments and muscles is they shorten and tighten. And that's why stretching is critically important, to lengthen ligaments and tendons and so on and so forth. I'm just going to show you, as I said, a few of them for the major muscles. So again, just to maintain a comfortable position, I just want you to imagine, just hold out your right hand. I want you to imagine that's a scarf. And just place that across under your chin. And with the left hand, just bring that arm just behind your ear if you can. And again, what's critical here is to breathe out as you stretch. Just breathe out gently. And relax. What you might find the first stretch or two is your range of motion mightn't be great, but gradually that will increase over time. That's normal. Just relax it. Bring it around your hand and back down. With the left hand, push that out. What do? We imagine that's our scarf, so put it under our chin. And with the right hand, just push that behind if you can. That stretches the shoulder and tricep area. Nice and relaxed. Breathing out all the time as you stretch. Breathing out, breathing out, breathing out. And come back. And relax. And now for the upper back. Again, it's an area that's often neglected too. Just place your left hand out, the palm of your left hand out, and similarly the right hand, and just interlock the thumbs. So just push them out there in front of you. Push them out, push out, push out, push out. Push them out as far as they can, and you just feel the muscles in the upper back lengthening. And now we'll come back in, and we'll push again. Just breathing out all the time. And come back. Just hold the stretch then for a couple of seconds each time. That's all. For the chest area now, and obviously lung capacity, lung area, so just come out to the edge of your chair. Turn your hands like so. Place them there on the top of your backside. Just place them there, and I want you to imagine you're a butterfly. That the wings of your hands are just closing together behind you. That will stretch the chest area. And then when you're relaxing, we can open them out. So just place them there on the top of your hips, top of your bum. Just try and bring the two hands together behind you, the pair of wings. Just try to bring them together behind you, and then just feel that whole chest area stretching. Breathe out gently all the time, and just when we're relaxing, just lower the two hands to the front, and now come back up again, and let the two hands, try to bring them together behind you, and relax. Well done. For the hamstring, we mentioned this already before, there's a very strong correlation between flexible hamstring and less back pain. So just to do this, you could even do this while you're at your desk, checking emails, extend the right leg forward, cross your hands like so, place them on the supporting leg, that's our left leg here, and just lean out over the extended leg. Just hold that stretch for a couple of seconds, you'll feel it, which is really good. And again, try and breathe out all the time. Just breathe out nice and gently. Very, very simply. You could be on a Zoom session or a webinar there as you're doing this and no one will see you. Turn the camera off. And come back. Similarly, left leg, drive that leg out as far as you can. Rest the heel on the floor. Cross the hands. Place them on the supporting leg. Just lean out over the extended leg. Nice and easy. Just do what you can. Breathing out all the time, never hold your breath. Breathing out, breathing out, breathing out. And come back and relax. And the last one we'll do for today is our calf. We mentioned this already, there's a little pump on here called the soleus. Hugely important. The more we can stretch our calf, the less cramps we'll have, and obviously the greater venous return to the heart, because it takes the blood from the lower extremities back up to the heart. So just push that leg out, drive it out, rest the heel on the floor there, and just turn the toes back to you. And you could be checking your emails on your phone. No. Just stretch it. Increase the blood flow to the calf. And if you suffer from this at night or cramps at night, just do this on the side of the bed before you get in. Just helps to increase the blood flow and kind of minimize the chances of cramp. And come back. And similarly, left leg. Drive that leg out, rest the heel on the floor, toes up, turn the toes back to you now. control for a couple of seconds. Always breathe out, never hold your breath, and relax. Folks, thank you very much. They're just a few activities that we have shown you. Again, activities from the chair. Again, the idea being to integrate activity into your daily life, particularly by moving more at work, to reduce sitting time, as we have said at the outset. But listen, my motto is, don't be hard on yourself. Just go from nothing to something. The fitter you are, or when your fitness improves, your capabilities will improve, the number of repetitions will improve, the more comfort, the more ease you will find in doing them. So don't be hard on yourself, give yourself that time, and it will happen. But listen, we would love to know what you think and your feedback. So if you wouldn't mind, you can let us know what you think of the activities and how you found them, and you can drop a line to paul.gillen@hse.ie. And we'd be delighted to get your feedback, because listen, we're always trying to improve, and I know we can improve this, but we'd love to hear from you. Folks, thank you so much for participating. I hope you enjoy them, and more importantly, I hope you feel better because of them.